Good day. So for today, we'll be performing the assessment of the cardiovascular system. So first, we want to identify our patient for this procedure, and then we'll explain the procedure that we'll be doing to the patient. So good day, sir. I am Nurse Glenn, and I will be your nurse for today. May I know your name?
Patrick Carlos.
Age?
20.
Birthday?
Back to 2001.
Okay, thank you. So after identifying our patient, we'll now proceed with the procedure of the IPPA for the assessment of the cardiovascular system. So for our inspection, we'll begin with the patient seated upright, and then we'll expose the chest of the patient. And then after that, we'll inspect for the face, lips, ears, and the scalp of our patient. And then after that, we will inspect for the jugular veins for the pulsation and distension. So with the patient sitting upright, we will adjust the lamp to the patient's neck. So assuming that this is our lamp, so we'll focus it on the patient's neck, and then we will have the patient's head turned slightly away from the side you are examining. So for this one, we'll look for the jugular vein for pulsation and distension. So the jugular vein is in this area, so we'll just look for the distension and pulsations. So if the jugular vein pulsations are visible, we will palpate the radial pulse of our patient. So assuming that since the jugular pulsations of the patient are visible, we will palpate the radial pulse to see if the pulsations of the jugular vein. So we are palpating the radial pulse of the patient if there is jugular vein pulsations to see if the pulsations of the jugular vein and the radial pulse coincide together. So after that, we will have the patient lie at a 45-degree angle. So for this one, we'll be needing 2 metric rulers. So the first one will be placed vertically at the part of the jugular vein of our patient. So first we'll place the first metric ruler at the angle of the Lewis, and then we will place the second metric ruler horizontally at 90-degree angle of the first ruler. And then after that, on the end of this ruler, there should be at the angle of the Lewis, and the other end is in the jugular area on the lateral aspect of the neck. So we will raise the lateral portion of the horizontal ruler until it is at the top of the height of the distension, and then we will assess the height in centimeters. Then after inspecting the jugular vein of our patient, so next we'll inspect the carotid arteries. So with this one, we'll still have the patient lying in supine position, and then we will have a tangential lightening. So assuming that this is our tangential lightening, so we'll inspect for the carotid arteries for pulsations. And then after that, we'll inspect the chest for pulsations. So we'll inspect the entire chest. We'll We'll inspect the entire chest for pulsations. We'll observe first the patient in an upright position. So we'll have the patient stand up. So we'll have the patient in an upright position for us to inspect the chest for pulsations. So for this one, we'll observe the patient in an upright position. So we'll observe the pulsations for the chest on the aortic, and then the pulmonic, and then the tricuspid and the mitral. So we'll just observe if there are any pulsations on these areas. And then after that, we'll have the patient in a mid-Fowler's position, and then we will also observe for these pulsations. So we'll have the patient lie down in a mid-Fowler's position. And then we'll just observe the same areas for the pulsations. So we'll also observe the pulmonic, the aortic, and the tricuspid and the mitral pulsations on the chest of our patient. And then after that, we'll proceed with the palpation. So first, we'll palpate the carotid pulses. So we will first warm our hands so that it will not shock our patient, and then we will place the pads of our first 2 to 3 fingers on the patient's neck between the trachea and the sternocleidomastoid muscle. And then after that, we'll palpate firmly but not so hard that you occlude the artery. So for this one, we'll palpate one side of the neck at a time. Then after that, we'll proceed with the next part of the neck of our patient. Then while we are doing this, we will note the time and then the rate on the rhythm of the pulsations of our patient. And then we will palpate the chest in the 6 areas for the apical impulse. So we'll remain the client on the right side, and we'll ask the client to remain supine. So for this one, we will use 1 or 2 finger pads to palpate the anterior chest for pulsations. So we'll begin with the aorta, and then we'll proceed downward to the apex of the heart. So first, we'll begin with the aorta, and then we will proceed downward to the apex of the heart. So we will localize the apical impulse precisely by using our pads of fingers and asking the client to inhale and exhale. So sir, can you inhale and exhale? Okay, thank you. So one more, inhale, exhale. And so for us to palpate the apical impulse in the mitral, so we'll have the patient lie on the left side, and then for this one, we'll use our palms to palpate for the apical impulse in the mitral. So we'll just place it here on the position of the mitral, and then we'll feel the apical impulse of the patient. So sir, inhale, exhale. Okay, thank you. After that, we'll proceed with the percussion. So for this one, we'll percuss so that we can know if there are any blockage in the heart borders. So we'll have the patient in a sitting position. So after the percussion, we'll proceed with the auscultation. So we'll be needing our stethoscope. So we'll place the diaphragm of our stethoscope on the chest wall, beginning on the aortic area. So after that, we'll proceed with the apex of the heart and AZ pattern. So first, we'll auscultate the heart rate and the rhythm. So for this one, we'll put the diaphragm on the apical impulse or apical pulse of our patient, and then we will also locate the carotid pulse of our patient. So for this one, we'll be comparing the apical pulse to a carotid pulse so that we could see if it is if there are any abnormalities, and it is also used because it is the artery closest to the heart and most accessible. So next, we'll auscultate to identify the S1 and S2. So for this one, we'll have the patient lie in bed in a supine position. And then we'll be using our stethoscope again to auscultate for the S1 and S2. So the S1 is the lob sound and the S2 is the dob sound. So we'll auscultate the first heart sound, which is the S1, which have the lob sound, and then the S2 is the dob sound. So remember, these two sounds make up the cardiac cycle of the systole and diastole. So S1 starts systole and S2 starts the diastole. And after that, we'll auscultate for the extra heart sound. So for this one, we'll have the patient roll on the left side so that we could auscultate better for the extra heart sounds. So for this one, we'll use again our stethoscope. So we'll place the diaphragm of the stethoscope on the apical pulse of our patient. And then we will auscultate for the extra heart sounds. So for this one, we'll auscultate for the extra heart sounds. So since the patient is already lying on the left side, we'll use the bell of the stethoscope to listen for the S3, S4, and the murmurs that the patient might have. So we are doing this because some murmurs occur or subside according to the client's position. So we'll auscultate in different positions, which is a left lateral position by using the bell of the stethoscope, and sitting up and leaning forward position by asking the client to sit up and lean forward and exhale. Use the bell of the stethoscope and listen at the aortic and pulmonic area. Exhale. Exhale. We're auscultating for the S3, S4 or murmurs with the patient lying on a side lateral position. So we'll now have the patient in a sitting position so that we could also listen for the S3, S4, and murmurs of the apical pulse. So with the use of our stethoscope, we will listen for the S3, S4, or murmurs with the bell of the stethoscope. Exhale. Exhale. And then after that, we'll ask the patient to lean forward, and then we will auscultate again. Exhale.
Now we're going to place the patient in a sitting position on the examination table. Then we're going to assess the blood pressure in both legs and arms. Then we're going to inspect the neck for carotid pulsations. And then palpate the carotid pulses by using 2 to 3 pads. Then we're going to take the patient's hands in our hands. Then we're going to inspect the color of the skin, the nail beds, the temperature, the texture of the skin, and the presence of any lesions and swelling. Holding one of the patient's hand in our hand, we're going to apply pressure onto the patient's fingernail for 5 seconds. And then we're going to repeat the procedure to the other hand. Now we're going to palpate the radial pulse of the patient. We're going to note the rate, rhythm, amplitude, and symmetry of the pulses. And then we're going to repeat the procedure onto the other hand. Now we're going to palpate both the brachial pulses of the patient. So in here we're going to note the rate, rhythm, amplitude, and symmetry of the pulses. Now, if you suspect an obstruction of or insufficiency of an artery in the arm, Allen's test will determine the patency of the radial and ulnar arteries. So we're going to ask the patient to place the hands on the knees with palms up, and then compress the radial arteries, both on the wrist, with thumbs. And then we're going to ask the client to open and close his or her fist several times. While you're still compressing the radial arteries, ask the patient to open or close his or her hands. Now we're going to inspect both legs. So here we're going to observe the skin color, the hair distribution, and any skin lesions. Then, the skin color should be matching with the skin tone of the rest of the body, and hair is normally present on the legs. Then we're going to compare the size of both legs. So both legs should be symmetric in size. If the legs are unequal in size, we're going to measure the circumference of each leg at the widest point. Now we're going to assess the legs for the presence of superficial veins. So with the patient in the sitting position and legs dangling from the examination table, we're going to inspect the legs. And then we're going to ask the patient to elevate the legs. The veins may appear as nodular bulges when the legs are in dependent position, but any bulges should disappear when the legs are elevated. Then we're going to palpate the veins for tenderness or inflammation. Now we're going to palpate the legs bilaterally for the temperature. So using our dorsal surface of our hands, we're going to palpate the legs of the patient. Now we're going to test for the Bowman sign. We're going to assist the patient into a supine position. We're going to flex the patient's knee for about 5 degrees. And then we're going to sharply dorsiflex the patient's foot. And then we're going to ask the patient if he or she feels any pain on the calf or not. Do you feel any pain, sir?
No.
Now we're going to palpate the peripheral pulses bilaterally. So first off with the femoral pulses. And then with the popliteal pulses. and then there's the posterior tibial, and then the dorsalis pedis of the patient. Now we're going to assess for the arterial supply to the lower legs and feet if the pulses in the legs are weak. So if you suspect an arterial deficiency, test for the arterial supply to the lower extremities. So we're going to ask the patient to remain in a supine position, and then we're going to elevate the patient's legs 12 inches above the heart. And then we're going to ask the patient to move the feet up and down at the ankles for 60 seconds to drain the venous blood. His skin will be blanched in color because only arterial blood is present. Now we're going to ask the patient to sit up and dangle the feet. Sir, sit up. And then we're going to compare the color of the both feet. Now we're going to check for the edema of the legs. Now, if edema is present, you should grade it on a scale of 1+ or mild to 4+ severe. Then lastly, we're going to document the findings.